My name is Daniel. Welcome to this very short demonstration of ATAH, application for treatment of arterial hypertension. What we are looking at here is an e-journal that is used by practicing doctors in Denmark. And what we have right here is a small shortcut to ATAH. The doctor will press this button when he's treating a patient with hypertension, which is high blood pressure. The click of the button there will take the doctor to a new web application, which is ATAH. Here he has some basic information about the patient's name and CPR number, which is pulled from Danish data registers, also risk factors and comorbidities. Down here we are pulling data from the laboratories on the blood values. We also have side effects in the middle, and then we have the medications that the patients receive and also a personalized medicine recommendation on the next best fit medicine for the patient to take. The doctor will start treating his patient by entering a new blood pressure. So here we can see that the blood pressure is falling. This will reflect on the graph and also on the development within the patient's treatment of hypertension. The doctor can, together with the patient, review how things are going. We can see that the system has calculated a 26% risk of developing a cardiovascular disease for this particular patient. That means that they have a 26% risk of getting a stroke in their heart or in their brain. Down here in Danish, we have a number of scenarios that the patient can select to further reduce the risk of developing cardiovascular disease. One of them is smoking, and this will lower effectively the risk with 12%. So if we select this, we can see that the system will calculate a new goal for the patient to reach if they succeed with their smoking stop. ATAH will also develop an entire treatment plan, and it'll make sure that the doctor contacts the patient again or the other way around in the appropriate amount of time after the first or the second visit. So now 2 months has passed, the patient comes back to the hospital, and a new part goal has been established for the patient based on the treatment and the goals that they selected during the last visit. The doctor will enter a new blood pressure, which has fallen again due to the smoking stop. And again, we can see that the risk falls, and there's an opportunity to go in and review and select even more options that will further reduce the risk of developing cardiovascular diseases. Everything behind the system is powered by validated medical algorithms that are developed by cardiologists at Danish hospitals and are based on clinical best guidelines and also published research protocols. Thank you for listening to the presentation of ATAH.